Hello and welcome to Common Health, a podcast brought to you by the Virginia Community Healthcare Association, where we discuss all things community health in the Commonwealth of Virginia, amplifying the voices of those who are served by our community health centers and those who serve them. I'm your guest host, Kyle Elliott, Chief Administrative Officer of the Virginia Community Healthcare Association. Today's podcast is the first of our series on Medicaid. The series will start with the basics on the program, how it operates in the Commonwealth, who is eligible for the program, and its importance to Virginia's healthcare infrastructure. I am pleased to introduce today's guest. Our first guest is Deepak Madala, Director of ENROLL Virginia. Deepak is a licensed healthcare attorney with an MBA and more than 10 years experience advising a diverse array of health coverage stakeholders on issues related to health insurance, Medicaid, eligibility for premium tax credits, and enrollment in Affordable Care Act health coverage options. Also joining us is Eleanor Sullivan. Eleanor is a Medicaid policy analyst and a navigator with the Virginia Poverty Law Center. She has spent her entire career in nonprofits, helping guide people to a better way of life. VCHA actually contracts with Virginia Poverty Law Center for the Medicaid training and technical assistance for work for the association. Deepak and Eleanor, welcome to Common Health.
Thank you so much for having us.
Thank you, Kyle.
Thank you for joining us today. Well, I'm excited to get started. Let's talk about Medicaid. Can we just start with the basics? What is Medicaid? And since Medicaid is a state program, how does it work here in Virginia?
Yeah, absolutely. So Medicaid is a public health insurance program. It is funded partly by states and partly by the federal government together, and it is health coverage for lower income families. It is free health coverage. All it does operate a little more like private insurance than people realize. There are various requirements to be able to get in. There are eligibility requirements, and there are various programs that Virginia has for Medicaid. Those can vary a little bit state to state. And I'll let Deepak talk a little bit about some of the separate programs we have in Virginia under Medicaid.
Yeah, thanks, Eleanor. Yeah, I mean, it's, Medicaid, we have been working, Eleanor and I, for many, many years with both enrolling people into Medicaid program and also on our policy side, working at the General Assembly and the federal level, kind of talking to legislators of the Medicaid program and why it's so important to Virginia and Virginia specifically. I think, as Eleanor mentioned, it's a very comprehensive health coverage program. A lot of people don't realize it actually covers just about 2 million Virginians right now. And it's not it really kind of covers the broad gamut of what you'd expect from that. Like, it's not just seniors and children and pregnant women. Like, it also includes like many, many adults, working adults and other categories that, it's kind of across the board, which is kind of nice in Virginia. As far as like how it works, Eleanor had mentioned this in her initial thing that, it's in Virginia, it's a very unique program in that it does operate a lot like private insurance in many ways, because the state contracts with companies who have insurance products. So we're talking companies like Anthem, Aetna, the United Healthcare Company, Centera is a big player in this. Mm-hmm. And so people, when they enroll in Medicaid, once they're approved, they actually have a choice between those various plans. And then they, just like with health insurance, they need to again find a provider that accepts that insurance and then go to see that, kind of access all of their various benefits through that program.
How many state plans do we currently have in Virginia? Was it 7 now, or?
Right now there are a total of 5 different managed care companies that are operating in the Virginia Medicaid program, which now actually is known as Cardinal Care. So that's something I think practitioners, and we've been in this a long time, and every couple of years, the state likes to change the name of the Medicaid program. Right now, it is known as Cardinal Care. So it's important for people to know that. And if you want to learn more about it, another very important name to know in kind of the Virginia Medicaid program is Cover Virginia. So Cover Virginia is the name of the website that people can go to in Virginia to learn about the Medicaid program, how to enroll. It's also the phone number that people can call to both learn about the program and apply. So people can actually apply for the Virginia Medicaid program just over the phone directly by calling the Cover Virginia call center.
Excellent. That's great information to share with our listeners. Thank you. Can you talk a little bit about how Medicaid functions in terms of how it operates in comparison to like a commercial insurer? Is there a co-payment and deductible like there would be under any other kind of health insurance plan?
Yeah, so I think there's some ways that Medicaid operates very much like commercial insurance, like many of us are used to. In other ways, it doesn't. And honestly, in a lot of the ways it doesn't are really positive ways. So one of the ways Medicaid is different from commercial insurance or, the insurance you'd have through an employer is it doesn't have cost sharing. So no copays, no deductibles. If you need to go to see your PCP because you're sick, that's going to be a free visit for you if you are enrolled in Medicaid. You need to go to the emergency room. Medicaid also covers that bill. There's no deductible you have to pay out before the insurance company helps you with those bills. So all that cost sharing, co-insurance, all that complicated business that unfortunately we all have to get used to through some of our private plans doesn't exist in Medicaid. I think the way that Medicaid looks more like private insurance, and maybe a lot of folks realize, is like Deepak said, Virginia contracts with private carriers that manage the care for almost everybody in Virginia that's enrolled in Medicaid. And just like private insurance companies, they're networks. So Medicaid enrollees are going to get a card and they're going to have to find doctors and pharmacies and network. And that's where they go to get care. So that looks very familiar to anybody that's familiar with private or commercial insurance.
Yeah. Well, Deepak, you were speaking a little earlier about the people who are covered under Medicaid. Anecdotally, I think there's a lot of misconceptions or misunderstandings about who qualifies for Medicaid. I think many people think you have to be unemployed, or misunderstandings about what kind of misunderstandings do you see about Medicaid?
Yeah, and I think that's right. I think, a couple of big ones are that, right? A lot of people assume that you have to be unemployed and have zero income, like completely destitute, or the rules are so cumbersome that it's just difficult. People have applied. Virginia's kind of Medicaid system, the way it looks today, is not what it looked like just 5, 6, 7 years ago. Right. It was a very different place in Virginia where a lot of people actually did not qualify for various programs. But that's not the case today. And then the fact is that the vast, vast majority of Virginians who are not eligible for employer-based coverage, Medicare, not eligible for marketplace insurance, right? If you have lower income, and I think Eleanor is really good at this, you can kind of give more details on the income, kind of give some really good examples of what we're talking about. We're saying what incomes can qualify, but that being said, you can still earn, some money and still qualify for benefits, because not everyone is offered employer-based coverage, right? We know a lot of people who work in jobs. We're talking about people who might work in restaurants and in hotels and lots of different types of jobs that just don't offer health insurance. We've never offered health insurance. And in a place like Virginia, we have a lot of people who are self-employed, right? We have a lot of entrepreneurs that are starting their businesses, may not be making that much money yet, right? They're putting all the money back into the business. And so that's where Medicaid actually becomes a very important source of health insurance for both themselves and their families. Another thing I'll note too, to add to what Eleanor was talking about, just Medicaid coverage itself, is that for some populations, it's actually becomes more comprehensive than even what we experience in kind of a standard private plan. An example of two key examples are one for kids. So Medicaid for kids has an important benefit called, and this is we try to stay away from the acronyms, but at some point when you're doing health coverage, you're going to talk about it.
There's a lot of them in the industry.
But the acronym that you just need to know, it's called EPSDT. And it's, again, I'll repeat, EPSDT. And it's a very, 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 I don't say the three varies for no reason. It's a very important benefit for all kids that are enrolled in Medicaid programs. And what EPSDT is it's not necessarily like a benefit in that, you can go to see a doctor and it'll be covered. What EPSDT is that if a doctor identifies a problem, right, through a screening or they identify they're screening someone's hearing, and they identify that their hearing could be benefit from some additional aids, then EPSDT then requires Medicaid plans to cover that. So we're talking about kind of devices and other types of services that otherwise would not be covered, right, under a standard policy. That's why an EPSD is super important for people who are enrolled, particularly kids in the Medicaid programs. The other thing that is, for seniors, right? So Medicaid is one of the most important coverage programs for long-term care. It's working at nursing homes and home health services, things like that. Medicaid is a very important benefit, which again, the benefits in the private market are just not there for that type of population. So that's why Medicaid really plays an important role for both with the seniors as well.
Yeah, absolutely. Eleanor, can you speak to, are there any other eligibility requirements other than the kind of the income thresholds that we spoke about that people would need to meet in order to get coverage?
Yeah, absolutely. The income ones are very, very important. But there are other requirements. Although all these requirements really do fluctuate a little bit depending on what program you're in. So if you're a child, your requirements are going to look a little different in general than if you were an adult, and that's going to look a little different than if you're a senior who needs nursing home care, right? So in general, obviously, you have to be a Virginia resident to get Medicaid in Virginia. Pretty intuitive. There are also immigration status requirements. So to get Medicaid for most programs, with the exception of some pregnancy programs, you have to have a lawful immigration status. And there are a couple of programs that are for folks that are on Medicare. So that's called the Age Blind and Disabled program. Also the long-term care that Deepak referenced that help folks get care in the home or that pay for them to be in a nursing facility if that's what they need. Those levels of Medicaid programs are actually much more stringent, and they have resource tests, which not all the other programs do. If you're a child, Virginia Medicaid is not going to look at your family's resources. They'll just look at your family's income. So yeah, there are other eligibility requirements, but again, they change quite a bit depending on the program. And in general, the eligibility requirements for kids programs and for pregnant people's programs are just a little broader and a little more generous than the other programs.
We've heard a lot lately about work requirements. Is that something that Medicaid currently has, or is that what's being looked at as a new kind of addition to the law?
Yeah, so that actually is another state-specific question. The vast majority of states in the U.S. right now do not have work requirements, and Virginia is among them. Virginia does not currently have work requirements for its adults, and very obviously not for its children. That is optional for states. Most states don't have them. 92% research has shown that 92% of Medicaid recipients who are adults already work or meet an exemption. So maybe they have a disability that keeps them from working, or they're a caretaker for a small child. So, I think generally work requirements tend to be a little bit counterproductive because most folks are already working or have a really good reason to not be working. And so most states have found that adding them just sort of puts in more red tape. It just makes it harder for people to get coverage and keep coverage, even though they're eligible. And then you run into anytime you have system issues and it's really hard to report something through the system, that can kick folks off of coverage, again, even though they're still eligible. So we are hearing some reports, and we've heard from some public statements from congressional representatives and senators that Congress is currently thinking about instituting work reporting requirements for Medicaid. And we should see within the next few weeks whether or not they move forward with that or not.
We know that under President Obama, we had Medicaid expansion under the Affordable Care Act, commonly referred to as Obamacare. Can you speak about what it means for Virginia to be a Medicaid expansion state?
Sure. Yeah, and I mean it's Virginia. It's for our purposes, it's actually relatively recent, right? We expanded in 2019, so the Affordable Care Act actually went into place in 2013, and so Virginia does like to take things very deliberately. Like they don't want to expand things very quickly, but they when they do make changes, they often do get it right in this case, and so they work closely across the aisle. It was a bipartisan effort to expand Medicaid in Virginia, and it was really because of the experience, right? So we knew when we only had kind of private insurance and very, very low income levels for the Medicaid program in Virginia, that we just had way too many. We had hundreds and hundreds of thousands of people who were ineligible for nothing. They couldn't get help anywhere. But that didn't leave the reality that healthcare costs were still very high, right? We had high medical debt problems. People just had to go to the hospital. You have to go to the hospital. You can't avoid that. And so you're ending up in the hospital with no affordable options for health insurance. And in a weird way, because of the way the ACA was structured, that if you actually made too little to qualify for the private insurance, then you were out of luck. You actually were what was called in the gap, right? And this was causing lots of hospitals to kind of close programs, to reduce their services. All of that changed, right? 2019 hit, Virginia expanded their programs to now cover, working adults. And for the first time, I think we now are historically low uninsured rates, right? They're actually expanding hospitals. They're adding new facilities. I think we've even seen through the health centers being able to expand services throughout the state. And this has just been a great kind of support for people's health and their kind of well-being that we've seen. And kind of now it's, we enjoy our work quite a bit because, a lot of our work nowadays is just helping people use their coverage, right? It was less about getting them access to coverage or enrolled in coverage. Now, a lot of it's people are enrolled, and it's more of helping them find providers, when they're going through, needing help with a specific condition or a situation, then we can put them in touch with providers that can now provide that, cancer treatment or the heart care that they need. And before, it was a struggle because they were uninsured. And so it's, health centers were always such an important part of that, right? We could send them to our partners at health centers and free clinics. But as we all know, it's not the full health system, right? They're missing onto those specialized services. And that's where health insurance or Medicaid in particular becomes super important for kind of closing that gap that they can now, get the primary care at their health center, but then go beyond and actually get that, specialized treatment as well.
Yeah. And speaking of, expansion and identifying specialized treatment, we have a growing opioid crisis in the country, particularly here in the Commonwealth of Virginia.
Right.
That's something that Medicaid has a role in tackling.
Yeah, hugely. Hugely. Medicaid is actually now the biggest payer in Virginia for opioid treatment and opioid recovery. And Virginia has been very deliberate about making that happen. In 2017, actually, Virginia created a separate program, the Addiction and Recovery Treatment Services Program. They call it ARTS because, again, we in the healthcare industry sure love acronyms. And that really expanded access to, addiction medications, to counseling services to help folks avoid relapse when they're going through recovery. And then when Medicaid expansion happened in 2019, those two things together really increased the number of Virginians who are struggling with addiction that could access substance use disorder treatment. So that's been really, really important across the state and has really been, I think, a life-saving service for a lot of people and something that, keeps entire communities healthier and safer.
Yeah, and I think I was going to note, I think that was just announced, I think just last couple of weeks ago that the current administration announced that there's actually been some really great progress being made on that, on the kind of the kind of negative effects of that opioid crisis that we've been seeing. They're starting to see that trend go in the right direction. And I think this just strong network of both the coverage that's available and also the centers. So there's been a nice increase in providers that are actually serving these communities because there's coverage available. So people can access the benefits and get services. And it's not just kind of a thing that had to be provided free of charge or at very low cost prior without any kind of financial support for those providers that are doing that great work.
Yeah, I mean, it sounds like Medicaid has a really important role to play in a lot of care for Virginians.
Yeah.
Uh, can you speak to a little bit more about what is the impact on Virginia's healthcare infrastructure from Medicaid, and what would it mean for it to either have people unenrolled or disenrolled from Medicaid?
Yeah, Medicaid and especially Medicaid expansion is really important to kind of keep providers there for all of us, especially in rural areas. So I mean, Medicaid, especially again, expansion really props up hospitals. Before Medicaid expansion, a lot of folks would come in, you can't really choose when you have an emergency. So a lot of people were using emergency rooms or having surgeries that were unavoidable. If they didn't have insurance, the hospitals were providing a lot of uncompensated care. And that was really starting to put a strain on a lot of Virginia hospitals, especially in rural areas. I mean, that actually the hospital in the furthest southwest part of Virginia, Lee County Hospital, shut down in 2013, and it was for funding reasons. And then when Medicaid expansion came along, our uninsurance rate really ticked down. So a lot of more folks who were going into the ER and having surgeries and seeking specialist care were insured, and those providers were getting paid more regularly. And that has really helped hospitals keep their doors open, keep all of their services really robust, have better staffing levels, which of course are things that benefit all of us. And Lee County Hospital, which closed down in 2013, it reopened in 2021 after Medicaid expanded in 2019. And the same is true for, other types of providers, especially community clinics. Really, really helps keep a network of care available in rural areas where there's just less of a density of providers.
Yeah, I mean, I think that's a really interesting and fascinating point. I mean, we often talk about the costs of Medicaid, but I mean, what are the costs of not having? I mean, how many, areas would not have services available without that Medicaid support? Without how many providers would not be available in certain regions of?
Absolutely. And I'll just make a point that's just kind of dovetails nicely with what you just mentioned there, is that one of the biggest places that, the state has been really focused on in the, last, really, I think it's a 10-year work to improve the maternal care in Virginia. We still, unfortunately, in Virginia have some very poor outcomes for, particularly African-American women, on maternal care. But, there's been a lot of investment, particularly on Medicaid, right? Medicaid's been a key part of this, that it's not something that just by spending money on Medicaid, it's a loss. It's actually saving the state lots of money, because if we have healthy moms and healthy babies, that's always a good thing. It's a good thing, both obviously for the health of the mom and the families, but it also saves the Commonwealth some lots of money, because, if they're ending up having deliveries in ER or with babies in the NICU, like, that's not good for anyone. And, the investments in both the Medicaid program, particularly, right, to try to give expanded coverage more for, women, regardless of their situation, right? That if they're low income, they can get help with their prenatal coverage, and then also postpartum. They've expanded postpartum care quite a bit in the state, so that for a lot of women now can get 12 months of postpartum care. That's fantastic, right? And that's all through the Medicaid program that's kind of supporting that infrastructure to help maternal care for both those moms and the new babies.
I really want to have every policymaker and elected official hear that, because you hit the nail on the head, and I think the cost of not having Medicaid or having it be as robust is a much worse prospect.
Right, exactly. And people are aware of kind of how things cost in healthcare, right? And that's like, there are certain things like, a prenatal checkup doesn't cost a whole lot at all, but a prenatal checkup can avoid very significant costs that are associated with ERs and neonatal intensive care units. Like, those are great things to have, and we have a great system of those in Virginia, but we best try to avoid, right, having to use and so Medicaid is trying a lot to kind of provide that support so that people can get access to primary care services and have healthy outcomes.
Absolutely. Can we, I I did want to talk about what are some options available for people who don't qualify for Medicaid but don't have affordable employer-sponsored coverage.
Yeah, so that's actually where the marketplace comes in. And the marketplace is essentially kind of a collection of private plans offered by health coverage carriers. And it's your usual suspects. You go in the marketplace and you're going to see plans by Anthem, Optima, Centera, Cigna, the people you tend to see when you get private insurance or your job, right? What's different about the marketplace is that the government subsidizes some of the cost of the plans on a sliding scale depending on the applicant's household size and income. So generally, the lower your income, the more rich a subsidy you're going to be, and then you're not going to be paying as much for your private plan. So that's a really great system. And when I'm explaining this for the first time to clients that have had no exposure to this, I tend to explain Medicaid marketplace as a two-tier cake, that you have Medicaid here as the first layer of your cake. And then as soon as you are $1 over Medicaid and you're now ineligible for that program, the marketplace is there to catch you if you don't have insurance through your job. And we know that's true for more and more people, right? I mean, we keep hearing about the hustle economy and how many people are working part-time jobs. They're starting their own businesses. They're just kind of working unconventionally. So marketplace is there if somebody doesn't qualify for Medicaid, and is there to catch you if your income is a little bit over, or for some other reason you don't qualify for the most part.
Yeah, right. That's a good analogy. I like that one. Deepak, did you have something else you wanted to add?
Yeah. This is what an important thing I like to talk about, that, we've now had a more than a 10-year relationship with the Virginia Community Healthcare Association, and it's really to build a network of assisters. So we have both a network of certified application counselors and navigators that are with our program, and we work very closly together. We actually have weekly meetings with our entire team statewide, and the reason we have our programs available is because this can get complicated. We've been talking about the Medicaid program, the Virginia marketplace, and there's employer-based plans too, like that enrollment process, and it absolutely can be complicated. We're not going to deny that at all. There's a lot available. Help is available. Financial help is available to help lower premiums and make things more affordable. But for individuals going through the process, right? Like learning about what program I'm eligible for, how to apply for that program, how to use those benefits, can get complicated for sure, especially the insurance. And so that's why we have a statewide network of kind of qualified assisters and navigators that people can go to. And many of the health centers have these COCs on site that people can go to and just get help with all of this. Like, I need insurance, right? I lost my job. I lost my benefits. What do I do? Right? Like that's it's a scary time for people. And, they want to kind of get reassured as soon as possible that they can have some, and then help available. And that's what's really nice about where we're at right now in Virginia, between the Medicaid program, Medicare is another important program, and the marketplace. And so, our network of assisters are available to help people just kind of navigate that whole process, and kind of then connect to it and then use those benefits.
That's fantastic because, of course, when it comes to healthcare decisions and insurance, these things can be very scary and confusing. Yep. So it's good to know that there is a network of resources out there that can help people navigate this. So thank you for sharing that. Well, we've covered a lot of topics today on, just the basics of Medicaid, and really hoping to educate people on what Medicaid looks like here in Virginia. Are there any other topics or anything you wanted to cover today that we haven't been able to get to?
I guess the one thing I would mention, when I'm mentioning it partly because I think of any of the Medicaid facts I have, this is what blows people's minds the most, is that Medicaid now plays a pretty significant roles in schools around the country. Medicaid is now a significant source of funding for schools because Medicaid reimburses certain services children get at schools, like physical therapy or just regular checkups. And I think last year, actually, Virginia Medicaid agencies ended up paying about $54 million out to Virginia's public school systems. So not an insignificant chunk of change. And schools are very, if something would have to happen to the Medicaid program or funding were to go down for it, that's going to trickle down to schools. And obviously that affects students that aren't even on Medicaid, right? And Medicaid helps pay for school nurses. I went to a public school that didn't have a school nurse, oddly, because we were really small. And so I thought school nurses were just somewhere you went and sat around to wait for your parents to pick you up. And then I started asking questions and talking to school nurses and hearing stories like, oh yes, the student went into anaphylactic shock in the school cafeteria after they tried soy for the first time. And the person that goes and administers an EpiPen and gives oxygen and stabilizes the child until an ambulance can arrive is a school nurse. And Medicaid pays for that. So that's, I think, another way where Medicaid is just kind of intertwined into all of our lives and, helps support the health of our children and other people, even if you're not directly enrolled. And that has, I think, even for me as a Medicaid policy analyst, digging into that a little more this year was really interesting and surprising for me.
Thank you so much, Kyle, for inviting us to talk about Medicaid and kind of what's available and how why it's been so important to both Virginia and Virginians and kind of keeping their health staying healthy and kind of also financially secure, because that's another piece I don't think we really got into it specifically. We were talking a lot about the state finances and federal, but it's also Medicaid has been a really key source of kind of reducing the burden on people's medical debt. Right. That we talked about a little bit, but it is an important piece that, people are uninsured, need help understanding where they need to go to help pay for health care and services. I think that's why it's very important for a lot of people to just be reassured that Virginia now has a lot available as far as financial help and assistance for people to afford healthcare services. And so I think that's where, just kind of keep repeating that, because a lot of people just don't know that. Like they've been enrolled in private insurance and that's great. But, when you lose your job and you're needing help, I think, looking out for, turning to a health center or one of our rural Virginia navigators, and we're happy to help people understand kind of what their options are and how to enroll in kind of affordable or free coverage.
Well, that's a great teaser for what will be a series on Medicaid. So I do want to thank you both. This was really enlightening, and thank you both for your time and providing such wonderful information for our listeners.
Thank you.
Thank you so much.
I'd like to thank Deepak and Eleanor for joining us today on Common Health. Our next episode on Medicaid will introduce a family who receives Medicaid. They will share what it has meant to their family. Thank you to our listeners for tuning into Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, and leave a rating and review. Or visit our website at www.vcha.org. Thank you.